All right, I've got just a touch of mental health this week. I didn't have a ton of stuff, but I wanted to talk about this because it happened to come up in my feed recently, and it's clinical depression and kind of the definition. And I'm only bringing it up because, as you know, Go Tell It to the Wall podcast, Go Tell It to the Wall, the entire entity, as well as myself, SeanO'RourkeLive.com, and everyone that works with us are big proponents of mental health awareness, mental illness awareness, and removing that stigma around mental illness. So I bring this up because this article popped up talking about clinical depression and kind of the difference between just depression and clinical depression. Not to minimize how debilitating depression itself can be. It's just that a lot of people don't understand the difference between depression and clinical depression. And I'm going to give you a direct quote from here. This is according to Daniel K. Hall-Flavin, MD, who's a doctor, obviously. Flavin or Flavin, I apologies to you, doctor, for not having your name right. Not that he's ever going to actually listen to this. Maybe, I don't know. And I'll tell you just the first paragraph here. Depression ranges in seriousness from mild, temporary episodes of sadness to severe, persistent depression. Clinical depression is the more severe form of depression, also known as major depression or major depressive disorder. It isn't the same as depression caused by a loss, such as the death of a loved one, or a medical condition such as a thyroid disorder. I don't want to get into details on thyroid. If you want more information on that, maybe we'll get into it another time, but definitely Google it. Kind of understand the connection with thyroid there. To diagnose clinical depression, many doctors use the symptom criteria for major depressive disorder, and this is in the Diagnostic and Statistic Manual of Mental Disorders, published by the American Psychiatric Association. And signs of clinical depression may include feelings of sadness, tearfulness, emptiness, or hopelessness, angry outbursts, irritability, or frustration, even over small matters. This is definitely something I'm guilty of quite a bit. Loss of interest or pleasure in most or all normal activities, such as sex, hobbies, or sports. Sleep disturbances, including insomnia or sleeping too much. Tiredness and lack of energy. Reduced appetite and weight loss. Definitely something I have problems with when I'm in a depressive episode. I know it's hard to believe. I put on weight quite easily. Anxiety, agitation, or restlessness, slowed thinking, speaking, or body movements, feelings of worthlessness or guilt, trouble fixating on past failures or self-blame. I do this on a nightly basis. It's horrible. That is a horrible thing. I fixate on everything, replay everything in my mind. I totally get that one. Trouble thinking, concentrating, making decisions, and remembering things, frequent or recurrent thoughts of death, suicidal thoughts, suicide attempts, or suicide. I have never been suicidal personally, but I have always had a problem. My anxiety focuses quite a bit on the inevitability of death. Unexplained physical problems such as back pain or headaches. And those are just a few things. If you're suffering from those, it doesn't necessarily mean you have clinical depression. If you don't suffer from any of those, it doesn't necessarily mean you don't have clinical depression. Well, I bring this up to just kind of have an understanding of the differences. The differences when it comes to your brain and clinical depression and severe mental illness compared to a depression that can be brought on by a life event such as the death of a loved one or something along those means, a breakup, whatever it might be. And I'm not even trying to say that clinical depression is necessarily, well, I mean, we can say it's worse, but is it more important to get help if you have clinical depression compared to depression? No, you should get help for either one. You really should. And that's why I bring it up, so that everyone can have a little bit of an understanding kind of how depression affects us, how it affects people that have it, and how it can then, based on those things that I just listed, can affect friends and family and loved ones of someone that suffers from clinical depression. Something to keep in mind. Maybe you're out there and you can relate to that personally. Maybe you're out there and you can relate to that because you know someone that deals with that personally. Or maybe now you don't have either of those things, but now it's kind of in your head. So you can think about it when you come across someone that has a mental illness. Things to keep in mind. I'm not saying, white gloves and you gotta be so fragile with someone that has mental illness. No. Trust me, I have a lot of friends that just insult me to my face. And it's kind of our relationship. And I don't mean in a mean way. It's just nobody's holding my hand with white gloves. Sometimes my wife when I'm having a really bad episode or something, but it doesn't mean you need to treat people differently. It's just something to keep in mind, so that When they're not showing up to parties or something, you know that maybe that's what's going on. When they don't want to go do certain things. They don't want to go see that movie, you know, whatever their hobby might be. They don't want to go play tennis with you. Do people play tennis? People must play tennis. Whatever it might be. Keep those things in mind. Keep it in mind.